Hello and welcome to Changemakers. In this show, we have interesting conversations with people who are making a change, making a difference, making an impact. Our guest today is Vineet Singal, co-founder and executive director of Anjana Patient Education, an organization that seeks to educate people about health and diseases so that they can make their own decisions and using technology as the medium to reach them. Vineet, welcome to the show.
Thank you. Thank you so much.
So tell our guest what exactly is the mission of Anjana Patient Education.
The mission of Anjana Patient Education is to work to solve the problem and the very epidemic problem of chronic disease in America. And this is a problem that has recently gotten a lot of play in the media, but not so much from the perspective of chronic disease for the underserved population. And by that I mean people who don't have health insurance and people who often visit what are known as free clinics. And what we have done is what we are trying to do is to bring health education as a medium to prevent the progression of chronic disease amongst these populations. And what we have found is that a lot of free clinics are solely focused on medication and as therapy as a source of treatment. And education, and especially preventative education, can be a very useful tool if done right and if using proper technology to bring about these positive changes in the lives of these patients. Stemming from my own personal experience, working at several free clinics in Texas and California, and going through chronic disease myself, I've realized the power of education to bring about awareness, and that awareness to bring about positive action. And that is essentially the mission of Anjana, is to bring that awareness and knowledge to patients at free clinics.
So this is fascinating. Who would be your typical client? Describe the person who will leverage this information.
Yeah, I mean, I think that the typical person who would be visiting a free clinic would be a middle-aged person, in their 40s or 50s, suffering from diabetes or suffering from hypertension, uninsured, on several medications, and they are going to a free clinic to either refill their medication or something like that. I mean, these types of patients who are common all throughout America, and free clinics serve. There's about 2,000 free clinics serving over 2 million patients, and these types of stories of people suffering from chronic disease and their, horrible manifestations, amputations, blindness, renal failure, heart failure. Every single one of these patients are headed for that kind of outcome.
I see.
And education is a powerful tool that we believe can help prevent that, especially given the fact that the age of people when they start getting chronic disease is slowly decreasing, and more and more young people are being affected. So that typical patient that I talked about, no longer middle-aged, could be a young person like myself.
So it's like an epidemic, as you said. So you founded this organization when you were at Stanford. You were junior at Stanford.
Sophomore at Stanford.
Sophomore at Stanford.
Yeah.
And for the last 2 years you've been.
Yes.
And where does it currently operate? How large is the organization?
We currently operate out of Stanford. That's where we are. We also have a chapter at UC Berkeley and a starting chapter at San Jose State University. But the main workings of the organization are at Stanford. And we're a group of about 250 volunteers, essentially. No one is paid on the organization, working with faculty at Stanford Medical School on these projects.
And where are the clinics that you serve currently?
Most of them are in the Bay Area. We have some clinics in Los Angeles County as well, but most of our clinics are in Bay Area.
So tell us a little bit about the impact you've had in the 2 years, either by talking about first-person stories. In fact, on your site, I saw a great story about Mrs. Maria. Or we can talk about one of those, or in terms of numbers, I just want to get a sense of how you've had an impact through this program.
Yeah, I mean, essentially what we have done for the past year and a half is we have created this network of 250 volunteers who have devoted over, these are not only students, they're graduate students, they're alumni, there are faculty mentors and doctors and physicians and nurses from various different places from around the world, around the nation actually, who have devoted over 15,000 hours of volunteer time to 3 of our projects. The first project has to do with creating health education information that is accessible and specifically designed for patients at free clinics. The second project has to do with creating interactive modules and video-based narratives. We call it Project Not Alone because we believe that chronic disease is something that people always believe that, especially in situations like mental health, that people are experiencing it alone by themselves. But, that's usually not the case. There are other stories very similar to the patients themselves. And we're doing, these interactive modules and these video narratives on a tablet-based system that we're implementing in kiosks at free clinics. And the third project has to do with sending text messaging-based reminders to patients to increase patient adherence to medication. So a big problem is that patients just don't take their medication, and what has been shown in research is that these smart reminders via text messaging can be extremely useful for these patients. So we're working with companies on implementing this system at various free clinics.
Now, isn't that in some ways a recipe for failure in the sense of it looks like technology is an important component of all of your services.
Yeah.
And yet you're targeting, said, underserved population, and wouldn't access to technology or just even the knowledge and comfort of using technology be a hurdle for these populations?
And that was one of our concerns when we started talking about these projects. One of the things that we found, just taking the SMS project as an example, over 80% of patients who visit free clinics who are uninsured, underserved, have cell phones, and they're heavy users of text messaging. So that's an existing network of technology that we're just tapping into for the purposes of health education and improving access or adherence to medication. In terms of the tablet project, that is a different story because a lot of these clinics don't have access to computers, let alone tablet computers. But what we're doing is we're hoping to work with various different foundations and companies to provide that technology because we believe in the power of that technology, especially given the fact that the usefulness of this technology is most apparent when you consider the time that is wasted when when a single patient visits a clinic, especially a free clinic. They waste about 3 hours just reading Time magazine, and we believe that the time that is wasted essentially waiting for the physician can be utilized for positive education, so that the patient is more aware about their disease, and they're more inclined to ask questions of their physician when they're actually in that examination room.
I see. Interesting. So when I look at this information you're generating, Vineet, the question that comes to my mind is, there's already a lot of information out there for patient education. I can go to any of the major hospitals or government clinics, and there's always these brochures lying around. I can go to Mayo Clinic website and find information. So what is it that you are doing that is new, unique, and different?
So we take all that information that is existing, that is out there, the Mayo Clinic, the American Heart Association, the American Diabetes Association, and we condense it, and we take the most salient facts and simplify them using very simple language, and we translate it into various different languages. And we use a lot of images. We have a huge team that is focused exclusively on translating complex medical information into images that can be understood. And picture says 1,000 words. It's a cliche, but it's also very true because it communicates so much more than what words can. And these kinds of materials that we're developing are interesting to the patients, and they convey the message very clearly. For example, we developed a brochure that visually depicts the amount of sugar different foods have. So it has pictures of different foods and just bars of sugar next to it. So the patient can very clearly see that eating a pound of cake is not as healthy as eating a bowl of celery. And so expressing all of that information, talking about how diabetes works and talking about expressing the feelings associated with depression visually is so much more important than writing that in text, especially given the fact that so many of these patients have below a 4th or 6th grade reading level. And all of that information that you've just talked about, the Mayo Clinic and American Heart Association, is developed with the general population in mind. And so it presumes a certain reading level that a lot of these patients might not have.
I see. But based on what you describe, I feel like it's not just the underserved population, but the general population could benefit from it, because even among highly educated populations, the general understanding of the human body, how it works, what happens in the brain, or biochemistry, I think, is very, very limited.
It is very complicated. As a biology major, it's complicated for me, and it's so interesting, but it's also very intricate. And explaining the complexity of insulin receptors and how that works in diabetes, it's difficult. So we use characters, we use images, we used a lot of different techniques, a lot of design techniques to be able to explain that information, not just in print form, but also in the interactive modules that we put on tablet computers, and making that very visual, and toward the end goal of ensuring learning, as opposed to instruction. Ensuring learning by these patients, and when they internalize that information, with the hope of ensuring positive action.
So a personal question is like, what motivated you to go in this direction as a Stanford major and living and studying in the heart of Silicon Valley? There are so many career choices that many of your peer groups are drawn towards, ranging from technology to other corporate or government service kind of. But you have chosen to go on this path. I know you still have not graduated, but you've committed a significant portion of your life energy to something like this. What drove you to this project?
I think that it was a whole bunch of experiences. The most direct one was it was my sophomore year in high school or in college, and I was thinking to myself, what it is I wanted to do, and I personally lacked something that a lot of my other classmates had, which was a passion, a calling, and I wanted to find that for myself. And I knew that there was need back home in Galveston. We had just been through a hurricane. There had been so many people who had lost their jobs, so many people who lost their health insurance, that we needed, people needed help. And the only free clinic, or one of the only 2 or 3 free clinics in the entire county of Galveston, when I was there for summer vacation, they were losing people every single day. And so I decided to take a quarter off from Stanford and work full-time at this free clinic, just volunteer there. And I was the only full-time volunteer. So my role began as just shadowing and just helping out with charts and everything, but it grew into something more meaningful for me. I started seeing patients, started doing vital signs, physical exams, taking their histories, doing point-of-care testing, and then eventually decided that I had seen so many patients, go through chronic disease that I, had to do something. And it wasn't just a big problem for me, it was a personal problem. Because when I was 18, I'd been diagnosed with what is known as pre-diabetes. I was 225 pounds, BMI of 34, which is, obese, significantly obese. And I lost, over the course of 2 years, I had lost over 75 pounds. So I had gone through chronic disease in my lifetime, and I knew how hard it was, but I also knew that the changes that I had made had benefited me, not just physically, but mentally, and helping me with like concentration and helping me with my confidence and things like that. So I knew how beneficial making that change was, and I knew that not just for the health, but also the overall wellness of my patients, making that change would be very valuable. So I decided to start like a mini health education program at the clinic. I counseled over 300 patients, helping them identify goals, create action plans, motivating them by sharing my own battle, overcoming obesity.
Now, at one point on off camera, during the sets, you'd mentioned that before you got to this point where you're able to make this lifestyle change, there were many points of failure where you could not make the change.
No.
So what was the pivot around which things shifted?
The joke in my family is that, I've tried and failed more times than, they can even count on their fingers. It's just, I remember my 15th birthday, my uncle bought me a treadmill, and I never used it. It was one of those things that I tried making a change, and I failed, and I tried again. I tried diets, I tried different exercise plans, and I always would falter and fall back on the same exact routine. But something changed after my 18th birthday, and that was receiving that news that I would be diabetic and dependent upon medication. I was taking medication for a little while to prevent that from happening. I was scared, because I knew that if I didn't change my behavior, I would be dependent upon medication. I would have all these medical problems. And I also was starting a new chapter in my life. I was going to school, college, Stanford, and I knew that I wanted to enjoy that experience, and I knew that I couldn't enjoy that experience if I was, or to the extent that I wanted to, if I was obese.
So, how are you structuring the program and the information to make sure that the similar kind of failure experience is not part of your clients? And what I mean by that is, in general, most people know by now that if you take a lot of sugar, it's bad for your body. It can cause diabetes. That fried foods are not good. Fast foods are not good for the body. And yet, people are not able to avoid consuming them in quantities that is not good for them. So and it goes beyond motivation, something around the psyche, and you have personal experience around it. So is there anything you're doing in terms of peer support or other vehicles to help them with this?
And one of the major foci of Anjna is to establish not just educational materials and educational information, but educational programs at these clinics. And so we develop curriculum to train volunteers at these clinics to become health educators and do very similar things to what I did at St. Vincent's Clinic in Texas. It's to actually work with individual patients, establish clear goals, establish action plans, and to follow up with them on a monthly or bi-monthly basis, and talk about ways in which they can improve and what they have done that is that has positively impacted their behavior and their health, and how that they can improve upon that, and how they have done things that might not be as good for their health, and how they can make those little changes. I mean, just one example, working with the Vietnamese population, a big problem in the Vietnamese community is high blood pressure. And a major contributor to that is Vietnamese sauce, which is an ingredient in a lot of Vietnamese food. Vietnamese sauce is extremely high in salt. There's a recipe for Vietnamese sauce that uses 1/4 of the salt and uses additional spices and everything. And tastes the exact same. Making that one change can reduce the chances of someone who's Vietnamese to develop hypertension. That's just one change. But the education about that is the critical step. And so ensuring that piece into the entire story of working with individual patients and being like, these are the changes that you can make today that might not be, as significant as, buying a gym membership and going to the gym for 2 hours a day. It doesn't need to be that drastic.
So small steps.
Even small steps can make huge impacts. Cutting down on soda from, 4 cans a day to 1 can a day. Might be difficult at first, but if you can do it, that cuts down the amount of sugar you're having per day by, almost 50, 60 grams.
Interesting.
Which is, pounds when you count.
Over a period of
time.
Switching gears, I noticed that on your site you now have a campaign. But before we talk about it, I also want to give you the opportunity. If our viewers want to find out more about the organization, get involved, similar to what Stanford faculty have done, where do they go?
The website is anjna.org, anjna.org.
And what are the opportunities for people to get involved and support?
The first and most important opportunity is for people to check out the website and for people to become aware of what we're doing and see if there's any way they can apply the lessons that we have learned into their own lives. They can also help volunteer for the organization. There's various different opportunities, translation, graphics, spreading the word, contacting clinics. There's various different opportunities for getting involved. And we're also doing a campaign that I can talk about, which is called Pledge for Patients, which has specifically to do with setting up these interactive modules on tablet computers at Schumann Laos Free Clinic in Oakland, California.
Now, and what is the clinic? What is the focus of this clinic?
This clinic specifically focuses on mental health education.
Okay, it's throwing me a little bit off. You said chronic diseases, and usually I think of like diabetes or obesity or heart-related problems, but mental health is much more complex, and depression and things like that are other sources. So how do you fit that into chronic disease category?
And that was our biggest challenge when we were first starting, was do we include mental health in the category of chronic disease? And what we have found is that not only is chronic disease, or rather mental health and diseases like depression chronic, but they're also preventable in many different cases. A big example of this is stress. Stress is a major contributor to a whole host of diseases, including depression. And the stress that is associated with economic factors, like losing your job or having to feed 4 kids and not being able to, is insurmountably significant when it comes to causing major depression. and a whole host of diseases. So what we have found is that mental health education, especially in underserved communities, is so incredibly important, especially given how stigmatized talking about depression or talking about schizophrenia or bipolar disorder.
But how are you going to prevent someone from losing their job or trying to worry about feeding their kids and the stress that comes with it?
I mean, the whole focus is not on reducing. These economic factors will exist regardless of what we do.
Sure.
But our focus is specifically on ensuring that patients take the right steps once they find out about their diagnosis. And what's a single most important example is something as simple as taking your medication after you're diagnosed as being depressed.
Okay.
A lot of patients, what they do is they stop taking their medication because they feel better. And that often results in even worse outcomes for the patients. Into relapse.
Mm-hmm.
And so just very simple education about what depression is, what causes it. And people think that, depression is caused by if you're weak inside or if you don't have that much self-control, you are more likely to be depressed. That is not the case. Depression is controlled by a whole host of genetic and environmental factors. And it's too complex that even scientists can't pinpoint the exact cause of depression.
Yeah.
So, and even understanding that depression is not something that's internal, it's something that has a biochemical basis.
Yeah.
And not understanding, the complexity of the biochemical basis for depression is very intricate and complex, but just having that understanding that it's not your fault that you have depression, and it's not something you should feel ashamed about, and it's something that you should discuss with your family, just like you would discuss the fact that you have diabetes or you have hypertension with your family, is so incredibly important, not just for the patient's well-being and for the patient's sense of belongingness, but also for the patient to feel that they have someone that cares for them, especially for a disease that is so sensitive like depression.
Oh, yeah, totally right there. So in a year, you were graduating from Stanford, right? And what are your plans for Anjana for patient education after you graduate?
Essentially, our goal is to focus on our two main projects, the first being the interactive modules on tablet computers. And essentially, I talked about this project before. The way this project works and the way these interactive modules work is that they combine animated characters who are going through a disease, and it follows the journey of that character throughout the character's life. Interspersed with videos of actual people talking about their experience with chronic disease. And we call this Project Not Alone. And this interactive module, the entire time the patient is plugged into this tablet computer, and after every single, you could say, module, they're given a quiz. So it tests their understanding, and it presents material based upon that understanding by the patient. And it's very interactive, so it involves the patient into the learning process. So we're thinking about including that as one of our, or we're considering including that as one of our major projects going forward. And the second project is the SMS project, utilizing text messaging as a tool to improve adherence to medication and adherence to educational interventions for patients at free clinics. And that is, essentially the future of the organization.
I see. Wonderful. Now, I had a location question. I was really both intrigued and fascinated by the fact that these kind of projects, typically people think of delivering the service in some distant, remote part of the world where they feel there is the most need. But you've chosen to do this right in your backyard. And are you planning now to take it to other parts of the world? Because you have content in Spanish and Vietnamese and Tagalog, so you could be spreading it to other parts of the world. Is that part of the vision as well?
Currently, the vision is to be able to establish a firm presence in the U.S. And we're working, all of our work has been with patients in the United States in mind. So for us to say that, our materials and our information could be applicable to patients around the world would be presuming, a lot of things about the cultural and other kinds of considerations that we have to take into account. That is not to say that the information that we have created is not applicable completely, but that is to, our goal right now is to focus on patients in the U.S. And free clinics in the United States. We do realize that there's a need around the world, but the original mission of the organization has been with the U.S. and patients in the United States specifically in mind.
Now, you've taken on a really thorny, complex problem that many former presidents have tried and have had mixed kind of success. And it's an industry and a space with so many interests between insurance companies and pharmaceutical companies and healthcare delivery mechanisms. Do you sometimes feel intimidated by the enormity and the complexity of what you have just stepped into at your young age?
Yeah. Absolutely. Absolutely. I mean, there's so much being done and a lot of wonderful work that's being done in many different areas. But I will say this. I will say that an area that is currently lacking in attention, both at a governmental level and also at a foundational level, different private foundations and everything, is our free clinics. They're being ignored in our society. Something as specific as health education for free clinics is a niche that we have found for ourselves. But it's unfortunate that we could find that niche and that an organization like ours didn't exist before.
Yeah. So before we wrap up, and we've got about a minute to go, I wanted to really get a sense of in about 30 seconds or so what keeps you going. Where is that inner drive coming from?
It's my parents. I mean, they have been role models for me throughout my life. Mm-hmm. They are both physicians, and they work tirelessly for patients every single day. And I mean, they are my inspiration. So they are my drive.
Fantastic. And I have to admit that your story is extremely inspiring as well. So congratulations on taking a path a lot less trodden and then paving the way.
Thank you so much.
So thank you for joining us on the show. Our guest today has been Vineet Singal, co-founder and executive director of Anjana Patient Education. And as you heard from him, an organization that is dedicated to bringing very simple, easy-to-use healthcare education to the underserved segments of our population so that they can take active steps, small steps in their life, to make a big difference to avoid chronic diseases. Vineet, pleasure having you on the show.
Thank you so much.
Thank you very much.